conference promises to be a remarkable platform for sharing insight. It is founding president of PDS, Honorary Chancellor of Yenapur deemed to be University.
Guest of honor Shri N. Vinaya Hegde, President, who is unable to join us today due to health constraints. So Dr. Jayaprakash Shetty, we are chief guest. Thank you, sir.
Dr. Naveen Kumar PV, Medical Officer from Mangalore Hospital, Secretary of PDS.
Dr. Surbhi Sinha, Treasurer of PDS.
Conference Coordinator for PigmentaryCon 2024.
Our scientific chairperson for PigmentaryCon our event by invoking the blessings of Lord Almighty with the prayer song. I would like to invite Arya
I now invite our dignitaries to bless this occasion by lighting the lamp.
Chairperson of PigmentaryCon 2024 to welcome everyone gathered here today.
Speakers and delegates, it's my great pleasure with the theme Harmony in Use to be held here in the vibrancy of Mangalore, a gathering of some of the brightest minds and leading experts in the field of pigmentary disorders. Mangalore's coastal region is not only renowned for its rich culture, pristine beaches, for being a historical hub of education and commerce. Not just an opportunity to share the latest research, innovation and exploration of new frontiers in the field of pigmentary disorders. The guest, the Honorary Dean to the University, Dr. Yenapur of Abbakka Medical College for gracing the occasion. Thank you, sir. I would like to welcome the members of the Pigment Disorder Society and also thank Dr. Rashmi Sarkar, President Dr. Malawala and her team for giving us this opportunity to conduct PigmentaryCon conference in Mangalore.
Pigmentary Disorder Society, to the dignitaries on the dais, we are fortunate to have Shri. Here, this conference was supposed to be held by another group, which unfortunately had a last minute change. And when I talked about this to my friend Dr. Manjunath Shenoy at a meeting, that we are at a back foot, we don't know what to do, whether his team would be able to, hold this conference. And he said without batting an eyelid that yes, it's possible. I will be the IIT president, but I have a good team behind me, and you're witness to that, I'm sure today. The morning we had these wonderful workshops, and also the very nice Onam lunch which you had, and the two medical colleges which are right across each other. They were able to put it across, and they had been working with clockwork, precision. In fact, all the people I named, they have just been working in and out with clockwork precision, and we are very grateful to them, because this was a time when, truly I could say that we were a little hands-off. We only came in for advice. I'm going to give you a little background of the Pigmentary Disorders Society since I'm here. This was a little society started way back in 2012 because there was felt a need for having a proper society in this area, both for hypopigmentary disorders as well as for hyperpigmentation. And that was when a number of experts from all over India, dermatology experts, came together and decided to form a society way back in 2012 at a very small meeting in Delhi. And from then on, of course, when you form a society, one of the agendas is having a conference, but it was at that point of time that we proposed that we are going to have a PIGMENTARYCON every 2 years, because there are advances in the field, but not so many advances to really have it every year. And we would like to keep the balance of conferences. I am very glad to say today, 11 years down the line, yes, we have completed a decade, that truly we have stuck to our word. We have not given in to the temptation of holding a conference every year, which, let me tell you, is also quite difficult, but we have done it every 2 years, so it is a very looked forward to conference. As rightly pointed out by Dr. Manjunath Shenoy, this is only the 6th PIGMENTARYCON, the others being held in Goa, New Delhi, Indore, Kolkata, Mumbai, and now here in Mangalore. So we've done this. The most important part of these conferences are that they have robust workshops, whether they're on vitiligo surgery, chemical peels, lasers, and so on, which I'm sure you've all witnessed today. We make it, a state of art. And then, of course, when we had this, we also brought in the journal. And the journal Pigment International was brought in 2014 with Dr. D.M. Thapa being the first editor-in-chief, me being the second, and now we have Dr. Senthil Kumaran as the editor-in-chief. But I'd like to tell you that it's not easy to bring in a journal, but more importantly to sustain it. But I'm glad to say that even by running a conference every 2 years, with whatever means we've had, we've been able to do it. And I'm sure that this could be a model for a lot more people to follow. And we've of course not compromised on the scientific aspect as well as the cultural and the other values, the social values. There is a lot of networking, and all of you go back home at least having made 1 or 2 friends. We have now a very good PDS Academy, with Dr. Surbhi Sinha, the chair, the convener being Dr. Indrashish Poddar. And then of course, most importantly, we also have international relationships. We became a member of ILTS way back, in 2020. And today we are a proud member of ILTS. We had delegates going there. We do, give lot of information to the directory and so on. And lastly, we are aware of our social responsibilities, and we carry on a lot of socially relevant community work. And we work, of course, with patients, who are suffering from pigmentary disorders. And also we combined hands with the Indian Women's Dermatologic Association to do one on congenital ichthyosis also, the Congenital Ichthyosis Society, and so on. A lot is going to happen, but the most important thing that I'd like to end is that we are going to be hosting the 7th PIGMENTARYCON along with the International Pigment Cell Conference that comes to Asia once in every 12 years, right? It's not just India, it is Asia. The last being in Singapore in 2014, that's going to be in 2026 in New Delhi. We look forward to welcoming all of you. But thank you so much, first of all, to the organizers, our the Chancellor, the Dean, as well as the delegates which are more the backbone of this conference, for coming from all over, and our dear esteemed faculty, national and
organizing committee for giving me this opportunity to speak and share my thought in front of you. Indeed, we are having actually we should have had a very, very special inaugural ceremony, because we were trying to witness two doyens of entrepreneurs together on a stage who took up medical education as their chosen field of interest and gave immense contribution to the society and the nation. That is Yenapoya Abdullah Kuni sir and Nitte Vinay sir. But unfortunately, due to some last moment things, Nitte Vinay sir couldn't make it for this occasion, and very happy my friend and the dean in charge, Dr. Jayaprakash Shetty, is here to represent Nitte University and Case Academic Medical Academy. It's due to the vision of these two gentlemen whom I just mentioned, and the support in this place, a small place. We don't call it as Mangalore, we call it as Abbakka, although it's a part of the district. The vision and support that they have given, we are able to do a lot of meaningful academic programs and bring a lot of delegates across India and world to this small place called Abbakka. I'm very happy that I'm here standing and representing partly the other institution, because I have worked for this institution, Nitte, for almost 11 years before I joined Yenapoya. Now I'm working there for 15 years. So I'm the apt person to be telling this, because I know what these institutions are. The way they are progressing, both the universities. Currently, both the universities have hit the within 100 rank in the NIRF rating. There are over 1,100 universities across India. That tells all about this within 15 years of span. And that's all possible because of these visionary leaders. We need to be very, very honestly appreciate their efforts, and the reason why Mangalore has been a center of education, apart from being the center of commerce, is because of these visionaries. Thank you very much for doing so much, especially for the medical community. A few thoughts that I would share here as I have that a little bit of moral advantage, that being representing close to 18,000 dermatologists across India. As we grow older, dermatology doesn't become a passionate field of practice alone for many of us. It's just not the patient-centered empathetic care, but also involves research, innovation, advocacy of public health, mentorship, sustainability of environmental health, very important, leadership, holistic dermatology, so many other things. Developing subspecialties is one of the immense importance when a field expands, primarily due to discovery of new drugs. Today we talk about precision medicine in dermatology. I think after oncology and probably rheumatology, the next field wherein we are employing precision medicine is dermatology, and also the demand and the advent of cosmetic instruments, which we call medical devices. Unfortunately, general public and even our friends from other medical disciplines are not very much aware of the advances that are happening in this field. It's often taken as a commercially, progressing department, which is not true. The dermatology has so much to offer, not just the cosmetic dermatology. There are plenty of other things. Today, a number of subspecialties have emerged in dermatology. Just to mention a few, a surgical dermatology, which we call it as dermatosurgery, pediatric dermatology, cosmetic dermatology, dermatopathology, teledermatology, dermato-oncology, trichology, which is becoming a robust field, subspecialty, photodermatology, and now we are witnessing this very, very important subspecialty, that is pigmentary dermatology, which is taken forward by the visionary leader, Dr. Rashmi Sarkar, because of which we are seeing the 6th Biennial conference, wherein we update a lot about pigment-related dermatosis. I consider this as a very healthy development, and most of us are practicing core dermatology. There's no doubt we have no choice, but it's important that, in fact, it's mandatory that we develop a special interest in one of these subspecialty. And the group, this elite group, what you're seeing, a lot of faculties, close to 70 or more than 70 faculties, these people have a core interest, special interest in pigmentary disorders. The why pigmentary dermatosis is so important, because it's one of the most conspicuous disorders because of the discoloration, especially in colored race like us, and are associated with a lot of social stigma and resultant discrimination. quality of life of a person with certain pigmentary disorders like vitiligo is as bad as a cancer. I'm talking about quality of life. That's true. Like, given a choice, nobody gets a choice obviously. That between cancer or a vitiligo, probably people may even take cancer but not vitiligo. That is the amount of, the discrimination that with the dermatological diseases with conspicuous color change has within it. And very important is when a conference was offered to us regarding pigmentary dermatosis. In fact, pigmentary disorder is very dear to my heart also, because my thesis was on pigmentary disorder. Although I would say this conference is happening, actually it's happening not because of me. I have given just an advisor role. I have been playing an advisor role. It is the leadership provided by Dr. Vishal Amit and Dr. Girisha B.S. who have shown their utmost professional approach in hosting this conference. And I also saw this a small amount of very healthy competition between two. Dr. Vishal Amin offered today the Sadhya. There is Onam Sadhya in the lunch, and Dr. Girish is ready with Ideal's Gadbad ice cream to be served after this program. So that's the kind of competition which is very, very healthy, apart from the scientific thing that we are noticing. Faculties and residents from both institutions have worked very tirelessly for me, and honestly speaking, I have honestly played just an advisory role because I have so much to do as an ideal president. You all understand that. So that's the reason I thought many people may be thinking it's Manjuna Shani. Honestly, it's not Manjuna Shani. It's because of these two gentlemen and all the support by the two institutions, including, I won't be naming because we are very big departments, and indebted to the guidance provided by the AC of Pigmentary Disorder Society, because of which we could host this conference. It said that to end this, my very brief speech, God works at light. We mortals work with pigment. That means God is the perfection, but we are not, we are actually imperfections. But I think if we are capable of solving this, the mystery of pigment, which it produces so much of prejudice and so much of and if you are capable of that, we are probably moving towards the perfectionism. That's what it is all about, pigmentary disorders. And here we are not just to learn the science, but also so many other aspects related to the science. That is why the theme has been aptly coined for this conference. Thank you so much once again. Thank you so much, delegates, for being in close to 300 numbers. For a subspecialty conference, 300 is a very, very big number in dermatology. Thank you so much.
Hosted jointly by Nitte and Abbakka, deemed to be university. It would be a great honor to share this stage with Vinay Gade. Unfortunately, due to some reason he couldn't make it, but I would like to say a few words about him. A very dynamic entrepreneur, having achieved diverse success in the field of education. He is a philanthropist, tech savvy, and avid sports lover. Above all, he is a very humble and down-to-earth personality whom I admire a lot. Dermatology is a unique branch of medicine that combines both clinical, surgical, cosmetic expertise. More and more medical graduates, especially girls, prefer to opt dermatology because of the scope and the subject, as well as the fact that it is very challenging, diverse and rewarding career. Abbakka deemed university offers a 13-month post-doctoral fellowship program and cosmetic dermatology for aspiring students. PIGMENTARYCON is devoted to skin color disorders. Skin disorders can have a negative impact on an individual's confidence and make them undermine their self-worth and well-being. Aside from the medical point of view, it's very unfortunate that skin tone has been crucial in creating social divides and serving as a foundation for social status and discrimination. Sadly, racial and ethnic discrimination and biased preference for lighter skin tone is also common these days. The theme Harmony in Use is focused on resolving skin color concerns in an attempt to dispel myths and other misconceptions about the skin pigmentation. I am sure that these concerns will be covered under the conference for a larger purpose. I congratulate the dermatology department of both the colleges for hosting this conference. You can be assured that our university combined will give you all support for meaningful academic endeavor in this context. A huge thanks to Mr. Nitte 6th Biennial and all participants for the PIGMENTARYCON for making time to contribute.
Dermatology is a much sought after subject. If you all know, when we started in the year 99, the medical college, it was very difficult to get a professor in the department of dermatology. So much so, it is very difficult to get a professor. We could show to the National Medical Commission or S2I Medical Council, only an associate professor or an assistant professor finish the NMC assessments, and we used to receive a lot of deficiencies, including an absent or deficient professor in the medical colleges. The things were evolved and the degree was awarded in MD Dermatology. We reached a stage that the MD Dermatology is not acceptable. The degree is renamed. In the sense, we want a professor who have MD degree in dermatology, venereology and nephrology. Those who are in the medical school would have experienced it. If you have a MD dermatology professor, no, he is not in the field of teaching cadre. I thank the association who have done a lot of work in recognizing this. Even now we have the problem till a year back. The requirements for the inpatients may be 30 beds or 40 beds. Having 80% or 75% of the inpatients is an Herculean task. Many of the association presidents are there. Whenever the assessment used to happen, it is difficult to have an inpatient, especially a place like Mangalore, where it is known for all the healthy life practice. So this will be resolved. I was told, having a casual discussion with Dr. Manjuna, around 18,000 dermatologists are there in the country, I believe. Look at the magnitude of diseases pertaining. Skin being the largest organ in the body, any of the time you can affect a disorder. Maybe name the topic, it may be hypopigmentation or hyperpigmentation. This is a much challenging subject for anybody to treat. A conference like this, Manjuna and I was mentioning, there are few takers for this specialty course on pigmentary disorders, and delegates may be less. So he was telling that once in 2 years we hold it. Even then he was mentioning around 300 plus odd delegates are participating in this conference. I think you go with very fruitful memories with these many scientific thoughts, many eminent speakers are there. Wish you all the best. KSI Medical Academy is celebrating this 25 years its existence, started in 99. It is named after a famous judicial luminary, then Lok Sabha Speaker, Justice KSI. After his retirement 40 years back, I started a small school at a village called as Nitte, and our journey from here. Today, under the able leadership of our Chancellor, it has grown into 3 important complexes. One is Nitte, where we have an engineering college, one at Mangalore, where we have health science. The third one is in Bangalore, where we have an engineering college, management college and first college. The medical college is affiliated to Nitte deemed to be university.